Hi, I'm Dr. Jonathan Chung, and today we're going to talk about why a herniated disc may not be the cause of your lower back pain. Many patients come in complaining about lower back pain, and many people have gone through other doctors, had MRIs done, and they've been told that the cause of their lower back pain is from a disc herniation inside of the lower back. We're going to talk about what a disc herniation is, what the pain from a disc herniation usually looks like, and why many of the patients that have chronic lower back pain usually don't have this herniation as the cause of their pain. So let's talk about what a herniation actually is. So this is a scan of someone's lower back. These little wedges over here are the lumbar vertebrae. This material that sits between the vertebrae is the intervertebral disc, which is a fibrous piece of cartilage that separates each of the vertebrae. Now the herniation is this little bubble that you see right over here that's sticking into this white area, which is called the spinal canal. The spinal canal is where the nerves come down from the spinal cord and they pass through the spinal canal and they're going to go into the person's lower back or down into the legs. Disc herniations can be caused by trauma, so if someone's been in a car accident, they've had a bad injury to the lumbar spine, it can tear the fibers of that cartilage, and that's what causes this gelatinous material to poke out and create this herniation. But it can also happen just through the aging process. So as people age, the material that surrounds a disc starts to separate, the fibers start to break apart, and the herniation can start to stick out from there. Now here's the thing, from an MRI, we have no idea what causes the herniation in that specific patient, especially if the patient is over the age of 40, where many patients are going to have disc herniations. But the tricky part is a lot of people can have herniations, even ones as big as this, and not necessarily feel any pain coming from that herniation. The classic example of herniated disc pain is someone will have a sudden sharp shooting pattern that goes down and from the back into the buttock and down into the leg, goes all the way down into the foot and even the toes. Patients with herniated disc pain or radiculopathy may also have a loss of reflexes that go into their knee or into their Achilles, and they may also feel sensory changes. They may also express weakness into the foot, ankle, or even in the hip. Now, these pain patterns are important because if we suspect that someone has a radiculopathy from a lumbar disc herniation, then those are patients that may benefit from spinal decompression. They may benefit from injections or epidurals. They may benefit from surgery in some of these more severe cases if the pain is very unrelenting. It's also important to recognize is that a lot of patients have bad lower back pain, but they don't have these radicular patterns. Now, this doesn't mean for sure that the pain isn't coming from the herniated disc. It just makes it a lot less likely. If it's a lot less likely, then we don't want to send patients down this path of getting injections, decompression, and potentially spinal surgery, because those interventions are less likely to be curative for that person's lower back pain.